Hi, I'm Joe. Sean helped me about 5 years ago. I had some really severe lower back pain, arthritis in my lower back, and he did a few procedures, did some nerve blocks, and really relieved my pain. Been basically pain free up until the last 6 months or so. I think maybe the nerves are growing back a little bit, and back really bothered me, getting to where I couldn't sleep through the night at all. Came a couple weeks ago, got another procedure, and literally pain free. And didn't realize actually how bad I was sleeping until after this last procedure. I sleep all the way through the night, don't roll over at all. I just go to bed, lay still, and sleep. So it's fantastic.
So, Joe, your diagnosis, in addition to arthritis, was sciatica. What you had was a herniated disc, as you know. Have you been completely pain-free in the last several years since your first procedure?
Yeah, that's been completely pain free. Nothing there.
And you had considered surgery and you decided not to do it because of
Yeah,
the
surgery's
high
really
failure rate,
yeah,
right?
surgery's really scary to me. It doesn't seem like a high success thing. This is a much more conservative approach, and so much happier with taking this approach.
How is your recovery? Immediately after your procedure, you go home, take it easy, and you're back to work the same day or the next day?
Yeah, I go back the next day. Work. I make critical decisions, so I don't want to go back straight back after an anesthesia. But go home, kind of groggy, take a nap until about 2 or 3 hours later, and then feel great.
And the procedure itself was very comfortable for you, right? You did not feel
Felt nothing.
any sticks,
Yeah.
any pain.
No, yeah. I mean, you're asleep, so you lay down on the thing. We talk to you for a minute, and then you're back in recovery. So nothing to be afraid of.
So, what's your advice for patients, people like you, who had back and neck pain? Would you recommend them to consider this first before running to a surgeon?
Yeah, absolutely. I mean, I think surgery is a really drastic option. If you do the reading and research, there's just not that good a success rate with surgery. And everybody I know that's had back surgery, they're back and back and back, and it's never really good. The recovery is horrendous from back surgery as well. This is a really conservative approach, and if you're like me, this approach will work. Sham told me the first time that the nerves will regrow over time. Maybe 4 or 5 years later, about 5 years for me, started getting some back pain back, and so we're coming back and do another round of it. But other than coming in for appointments, it's really nothing to it.
And you're not required any pain medications in between or anything like that.
No, I actually have
You've
a
been very
bad.
active,
I have a
right?
bad foot, and I take an Aleve every day for my foot, but I don't have to take anything for my back.
So
So
we'll have to treat your foot pain now.
yeah, there you go.
All right, Joe, thanks.